We are staying on top of mental health tonight as we get into your eye on health. Tonight we're focused all on Alzheimer's disease. So let's give you some data here. The CDC says nearly 7 million Americans, we're talking 65 or older, are living with the disease. That's just in the last year. That number expected to grow to about 14 million by 2060. So research is continuing, and we told you just this week a new drug to treat Alzheimer's type diseases passed its first hurdle. So that is some good news. We now have 2 drugs on the table that can help kind of slow down the progression of the diseases. But we can't do it without our medical expert. We've got Dr. Carol Wellaway from Baylor Scott and White. Always happy to see you. Thank you for being with us. So the first thing I want to ask you is, fine line here. At what point are we just being forgetful? What point do we move from being forgetful to maybe there's something more concerning? Maybe this is Alzheimer's.
Yes, great question. So the brain takes up about 20 to 25% of the energy that the body uses. So it's a lot of work. And so it is normal for the brain to forget things. Some of that is even helpful. If we weren't able to forget traumatic issues, pain, it would be very difficult to continue and live a healthy life. So that part is normal. If it's happening over and over and over again, those are the times when you really should talk to your doctor.
I found myself asking the same question too. At what point is this a concern? What point do you have to start writing everything down or asking people, have I already told you this story? Did I already tell you that before? So that's a good thing to flag. If we talk about causes and risk factors, there are different groups that are more susceptible, more likely to have this disease. What are some of the things we should be watching out for?
So blood pressure, diabetes, some things that we've talked about before, eating a healthy diet, making sure that you're getting a lot of physical activity, smoking and excessive alcohol use are all risk factors of developing Alzheimer's as well.
And is there anyone that's more susceptible? Is there anyone that needs to be especially cautious when we talk about those risk factors?
At this point, we're seeing it can be seen in any ethnicity. And that is important for all to know, so that as they are seeing some of these symptoms, making sure that you're talking to your doctor about that.
Now, we talked about that new drug passing kind of step 1 for slowing down the progression. Doesn't cure it, but it slows down the symptoms and the progression of it. Are we any closer to a cure? Is there any research out there that's kind of indicative of that?
There are a lot of interesting studies out there right now. One looking at diet and finding that the Mediterranean diet, which we've talked about a few times here, can be helpful in decreasing and slowing the risk of Alzheimer's. There's actually a sleep medication that people are looking at. There does seem to be some connection between sleep and Alzheimer's. And so that's something that still needs a little further study.
So if we talk about ways I'm sitting at home watching this saying, okay, I can eat better, I can exercise. Is there anything else that's holistic or, of the same approach that could kind of wean away our probability of getting this?
Sleep. Sleep is so important. That is your brain's downtime. That's when it can relax. That's when it's really working hard to put memories together. So making sure that you have that time is important. And of course, keeping your brain active. So a lot of people talk about Sudoku.
Yeah.
Dancing is
Wordle.
really good. Wordle.
That'll hurt your brain. In a good way.
Things that you have to move and think and remember are all great for
And you
brain.
can do that at any age. I mean, the data we had was, 65 and older for folks who are living with Alzheimer's, but at any age we can start to get brain healthy and be aware of that, right?
Absolutely. And there is early onset Alzheimer's that can start as young as 30. Very rare, but it does happen.
Very good reminder there. This will be posted, I should say, on our website, CBS News Texas. If you have any questions for Dr. Wellaway, you can email me at mbaker@cbs.com. We can bring it here. Eye on Health. We love to talk through these things. Thank you so much for being with us.